This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
They've been around for decades, tripped through the summer of love and linked to some of the greatest music of the 60s and 70s. They brought ecstasy to the raves of the 80s and 90s in colors and euphoria. But psychedelics had a darker side too, and many experienced bad trips that ended in tragedy. So why are they being medically investigated now? That's our focus straight ahead on Prescription for Life. Hello and welcome to Prescription for Life. I'm Monica Robbins. Today we're taking a trip of sorts, talking about the benefits and history of psychedelic therapy. But to understand it, we have to take a look back. What a long, strange trip it's been for psychedelics. Ancient cultures relied on natural substances like peyote, ayahuasca, and psilocybin from mushrooms. Over at Case Western Reserve University,
Karl Popper is one of the first Indian philosophers in the West.
Religious studies professor Dr. Deepak Sharma offers a class on psychedelics and spirituality.
People did these substances, consumed these substances with specific guides who were trained to assist in order to attain desirable cognitive states.
Fast forward to the 20th century, science discovers MDMA or ecstasy and LSD. But by the 70s, despite extensive federal research, the government begins criminalizing psychedelics.
This was a threat to the conventional, shall we say, government, for sure. And it's a real threat when people's minds get opened up and they question the structures that exist, the institutions that exist.
By the 21st century, with depression and anxiety rates skyrocketing, new research begins using psychedelics for mental health disorders.
PTSD, depression, and treatment-resistant depression have all been given breakthrough therapy status by the FDA, meaning that the evidence is so strong that they are kind of green-lighting and fast-tracking those substances through the approval process.
In 2020, Oregon became the first state to legalize psilocybin-assisted therapy and decriminalize possession. Colorado followed. Several more states introduced legislation. Ohio's attempt never made it to a vote. Green Bay Packers quarterback Aaron Rodgers admitted using ayahuasca to, in his words, help support his mental and spiritual health.
I had a magical experience with the sensation of feeling 100 different hands on my body, imparting a blessing of love and forgiveness for myself and gratitude for this life from what seemed to be my ancestors.
While there is promise, there is still much more research to be done.
Just because a recreational drug has a potential effect in one area does not make it a solution for everything.
Previous clinical trials showed treatments may only require 2 or 3 doses spread over a few weeks, but they also require intense psychotherapy and at least 2 trained supervisors during the proverbial trip that could take several hours.
How are they credentialed, these allopathic guides? Do you need to take these substances to be credentialed?
Dr. Sharma is concerned for those who may have a more religious experience.
Therapist who's very familiar with, say, Christianity, how would he, she, they respond to a transformative experience of a Hindu who has what one might call a Hindu mystical experience?
Currently, MDMA is showing promise for post-traumatic stress disorder and psilocybin for treatment-resistant depression. Research shows the substances open pathways in the brain relating to memory and emotion.
So there's this term called quantum change, where it's really the pairing together of something spiritual and something insightful, and the combination of these experiences, when they happen simultaneously, might promote change in someone's experience of life.
This month, Australia became the first country to formally recognize the therapeutic uses of psychedelics, but it will not be the last.
So we're likely within 1 to 2 years at this point, based on what I can tell, for those drugs to be approved.
When we come back, we'll talk to an expert who will break down a variety of clinical trials testing psychedelics and give his take on the retreats being offered on social media. are so many clinical trials happening now relating to psychedelics and mental health. To learn more about them and their status, we talked to an expert on the front lines who's leading a few. Joining me now is Dr. Brian Barnett, a psychiatrist and director of Cleveland Clinic's psychedelic program at the Center for Behavioral Health. Thank you so much for being with us.
Thanks for having me.
All right, psychedelics, Cleveland Clinic, not words I ever thought I'd put in one sentence, but it's happening, and we're going to get into Cleveland Clinic research in just a bit. But I want to talk about a big blow that was dealt to psychedelic research in August. The FDA decided not to approve MDMA for PTSD. That was a drug that you yourself truly thought was going to get approved. So first of all, let's start with what is MDMA, because most people think it's a street drug.
Yeah, MDMA is commonly known as ecstasy, but it's a drug that's considered a psychedelic by some, not by others. It does have a different mechanism of action from things like LSD and psilocybin, but it does produce similar effects. And it has been used to treat a variety of psychiatric conditions since the late 1970s and early 1980s. And then the DEA made it a Schedule I drug, meaning that it had no medicinal potential and a high abuse potential. And that was 1985, I believe. So that really kind of slowed down research. But a lot of that's picked back up over the last 20 years.
So it was being researched for PTSD. Why?
Yeah, the drug has some unique effects, that we think could be helpful for patients with PTSD. And PTSD is a condition that people experience when they've had severe trauma, which can cause a number of symptoms, including re-experiencing that trauma through flashbacks and nightmares, being hypervigilant, so they're constantly on edge, looking over their shoulder, worried they're going to be traumatized again, and problems controlling emotions after the trauma. But it can be hard for patients with PTSD to do what we call trauma-focused therapy, which is the best treatment for the condition. And that's where they work with a therapist to revisit the trauma and work their way back through it so that it doesn't have the same emotional effects on them. And MDMA seems to have particular abilities for building rapport quickly with therapists and experiencing emotionally laden memories in a way that makes them, more accessible and allows patients to deal with them more easily.
So this was also studies that were being watched by veterans organizations. It was politicized as well, it was bipartisan. Everybody was watching this because they wanted to see if this could be the first type of psychedelic approved for a mental health disorder that so many people are dealing with. And the clinical trials were done at several centers, correct?
Yeah. These were multi-site trials done across the country, and actually some of them outside of the U.S.
And so, the clinical trials were done, they were submitted to the FDA, and then all of a sudden the FDA says no. Yeah,
I think it's important to clarify. So the FDA, didn't say no, this is the end of this. They requested an additional phase 3 clinical trial, which is a large clinical trial. Normally, you need 2 positive phase 3 trials for the FDA to approve a drug, which MDMA did have, but the FDA had some questions about data and wanted more data collected, it seems like, and so they've asked for a 3rd trial.
So how long is that going to take? Because I think that's the question a lot of people have.
Yeah, it takes quite a bit of time to work with the FDA and the DEA to design these protocols and get permission to import the drug, store the drug, and then to enroll participants to analyze the data. So I think it would be something on the order of 3 or 4 years before that trial is complete and the data are reported out so that the FDA could do a reevaluation.
So it's almost essentially starting over?
So they're still able to use the existing data, and we don't know exactly why the FDA said no. So when the FDA, tells a manufacturer that they're not going to approve the drug, they send a letter with their concerns and their requests. And the sponsor can publish that letter publicly if they want to, but they don't have to. And so Lykos Therapeutics, which was the sponsor of the MDMA application, has chosen not to make that letter public. So like I said, we don't know why the FDA said no, but there were some issues that came up in the FDA Advisory Committee on MDMA a couple months ago. And that committee raised concerns that there had not been adequate data collected on MDMA's effects on the heart, on the liver, and it's unclear why those data weren't collected, because they're those are pretty routinely collected data in clinical trials. But I do wonder whether the sponsor was asking the FDA to use previously collected data from the 90s and the 2000s, because there were a lot of studies done back then on the pharmacology of MDMA. So we actually know very well how MDMA affects the human body. And so I wonder if the sponsor was relying on the FDA to use those older data, and the FDA didn't agree with them on that.
Did MDMA work? Was it successful?
Yeah, that's probably the most puzzling thing about this decision. So, just to take a step back, the initial trials had been so promising that the FDA granted MDMA what's called breakthrough therapy status, and not a lot of drugs get that. And when they do, they're primarily oncology drugs for cancer. But the results were very positive, so the FDA said, this is a breakthrough therapy. And what that means is the FDA is more involved in the design of the trials moving forward, so that the trials are designed in a way that will preemptively answer the FDA's questions, so that you don't run into issues where the FDA says, this trial looks good, but we had one other question and you didn't address that, so now you have to do another one, which is essentially what looks like has happened with this application. And so that's that's why this is puzzling. When a drug has breakthrough therapy status and it's not approved, it's usually for one of two reasons. One is that in the later phase 3 trials, the efficacy is not the same as it was in the earlier trials, and the drug doesn't look efficacious. The other one is if new safety concerns arise, which sometimes you don't see if they're very rare until you do those large phase 3 trials. And as far as we know, based on the publicly published articles in medical journals, neither of those things happened with these trials, and so that's that's been really puzzling for the field.
So what does that mean for MDMA being studied on other mental health disorders?
So investigators can still move forward with those trials, and they are. This decision was for a particular application by one company, Lykos Therapeutics. So there are many academic investigators who are not seeking FDA approval for MDMA, who are just interested in exploring what its therapeutic potential could be. And then there are other companies that are working with MDMA or derivatives of MDMA to eventually gain FDA approval. And all those applications are treated differently. But yes, previous studies have shown that MDMA-assisted therapy might be helpful for things like alcohol use disorder. There's interest in looking at it for eating disorders, borderline personality disorder. So yeah, we are seeing a lot of interest in MDMA research right now across the world.
MDMA isn't the only psychedelic being researched. We have a giant mushroom behind us, which is relating to psilocybin. Mm-hmm. Psilocybin has been around for eons, and obviously it's a natural substance coming from a mushroom, but explain how it's being tested, and Cleveland Clinic is part of this testing, correct?
Yeah, that's right. So there has been a lot of interest in psilocybin over the last 20 years or so. There was research that got underway at Johns Hopkins, NYU, and some other universities that showed that psilocybin can be helpful for some mental health conditions, including depression. And now there are several companies that are interested in getting their psilocybin product approved by the FDA for depression, treatment-resistant depression, and other conditions. And so we are working with one of those companies that is investigating psilocybin for treatment-resistant depression, and we're in the middle of that trial now. But it's a phase 3 trial, so one of 2 ongoing phase 3 trials. And if the results are positive, we could see the FDA approve the first psilocybin product by early 2026 or so.
This is a little different, though. This isn't just, growing mushrooms in a dark place and chopping them up. And explain what the product is.
Yeah, so it's very difficult to go to the FDA with a plant or fungal product and get that through clinical trials so that the FDA approves that organic product. And what's going on with psilocybin is there are companies that are using synthetic forms of psilocybin, and different companies are taking different approaches because there are different opportunities for patenting psilocybin based on the route of delivery or minor changes to the chemical structure, and that's what these companies are doing. So they're all trying to tweak the molecule in different ways so that they can say this is a new version of psilocybin. This should allow us to have patent protection so that we can bring this to the market in a way that's profitable for them.
Is it safe?
Yes, in clinical settings. People do run into problems in non-clinical settings, but there's always risk. With any sort of drug that you put in your body, there can be risks, and that includes things like Tylenol and ibuprofen. People die every year from those medications that are over the counter. But psilocybin, I think the most important risks to highlight are that, number one, it alters consciousness significantly. And when that happens, people are in a vulnerable state. Their judgment can be impaired. There are cases where people have had injuries and even death when they were using psilocybin and other psychedelics outside of clinical settings and wandered onto roadways, railways, those sorts of things. So to address this when we're doing this in the clinical setting, there is at least one therapist with a participant at all times to make sure that they're safe. They're in a room that's decorated in a very soothing way. They're encouraged to lie on a couch, listen to music, wear eye shades. So point number one for us is safety. So that's the first thing that we address. Then there are some other potential side effects. Some of them are common. We know that psilocybin typically raises blood pressure and heart rate in a way that's usually pretty mild, but people with severe heart conditions, uncontrolled high blood pressure, a history of stroke, those sorts of things, they are excluded from these trials, and we do think that there's considerable risk if you have one of those conditions and you take this drug. In terms of psychological risks, people can get anxious when they're under the influence of psilocybin, so the therapist and the setting of the room are very helpful for reducing the odds of that and helping them through that if that happens. And then there are very rare risks of psychosis, so people who are hearing voices, becoming paranoid, and mania, which is something that's part of bipolar disorder, where people have an excessive amount of energy, they have decreased need for sleep, they're doing things that are getting themselves into trouble, talking very quickly, it's hard to follow their thought process. And the biggest risk factors that we've identified for that are, of course, if you have a personal history of a psychotic disorder or bipolar disorder. So those patients are typically excluded from psychedelic clinical trials. But there's also the ability of psychedelics and many other substances to possibly uncover those conditions if you have a genetic predisposition. And so people who have family histories of things like schizophrenia or bipolar disorder, particularly in close family members, so parents or siblings or children, they're excluded from these trials as well.
Wow. So, I'm hearing you say during a treatment, somebody has to be with the patient the entire time. How long does a psilocybin treatment take?
Yeah, so it's a pretty involved process, and I don't think we'll ever get to the point where psychedelics are being sent home with patients to self-treat, because the risks are real, and the medical field's taking that very seriously. But the sessions themselves can be anywhere from 6 to 8 hours, and so it's a pretty logistically complicated process to schedule that. People can't drive themselves home afterwards, and so there's a lot of different aspects that we have to take into consideration when we're scheduling these trials, and also patients have to be prepared for them as well. We don't just meet with them and go right into a psilocybin session. They have what are called preparation sessions where a therapist will talk to them about what to expect from the experience if they do get active drug. It's a randomized placebo-controlled trial, so some people get placebo, but they tell them, what to expect and talk to them about what they want to get out of the experience and have them set an intention. They need to think hard about, what do they want to change in their life? What do they want to know about themselves? What do they want to get from what can often be a very profound psychological experience?
There's already a mental health worker shortage. How do you get people who can actually understand this particular type of drug? Because, it's so new. You don't have a lot of people who understand the experiences of what somebody might go through with this. Yeah,
there's very intensive training for all of these trials, and it's not something that you can learn in clinical practice. You can learn some by talking to patients who've used psychedelics on their own, and maybe they're coming to you with a very positive experience to talk about, or something very negative happened to them. But there are dedicated therapy treatment training programs for psychedelic-assisted therapy, to participate in the trials, you have to undergo that intensive training, which can be 100 hours or more.
Wow. So, how long are you still recruiting for the psilocybin study?
We are. Yeah. We expect to recruit into the spring.
Wow. And this wasn't the only study you did. You did complete an LSD study.
Yeah, that's right.
So, how did that go?
Yeah, so that study, the results have been reported by the company, so they haven't been published in a peer-reviewed journal yet, but the company did report what's called the top-line results, where they sort of give a summary of what was found. And that study involved a single dose of LSD monitored by two session monitors. It was for generalized anxiety disorder. And the patients were followed for 12 weeks or so to see how their anxiety did. And something like two-thirds of them had a therapeutic response, and most of those participants actually had remission, so they didn't have generalized anxiety disorder anymore at that primary endpoint. So
I'm wondering, as I'm listening to you say this, these are drugs that, if somebody takes these, how many doses do you have to have, and is this something you have to continue the rest of your life?
Yeah, that's the big question. I think they are drugs that many people who take them and benefit will have to take them multiple times over the course of their life. I think in the past, there was sort of this narrative that you do this once or twice and all your mental health problems go away. That might be true for some people, but we know that the brain often goes back to the configuration that it was in before, and can do that very slowly over the course of months or even years. And we see this with other treatments too, like transcranial magnetic stimulation, TMS, or electroconvulsive therapy, ECT. So ECT, for example, it's considered the gold standard treatment for depression. At 6 months after you're done with the course of ECT, about 50% of people relapse. So 50% get benefit beyond 6 months, which is incredible. But we think of psychedelics in a similar way. So I do think it's something that people are going to need to take maybe a couple times a year on average, but there's wide variability too.
What's your concern, though, the fact that people are just, you're studying psychedelics, but they're readily accessible out on the street?
Yeah, it's an interesting challenge for the field right now, because there's a lot of media coverage of the positive results of these trials. Patients are interested. Many of them are suffering tremendously, and they don't want to wait because you can access these pretty easily here in Ohio. We have psilocybin containing mushrooms, out in the woods in some people's yards. And we do encounter a lot of patients who are already trying to treat themselves with psychedelics. And some of them who are doing this in the community, they report that it does help their condition. We also run into people who have bad trips who say that now they have long-term anxiety, or things have gotten worse. And I think what's missing there with the self-treatment is that you don't have the therapeutic component. So we believe that psychedelics induce something called neuroplasticity for about a month after you use them. And so what that means is your brain is more flexible and malleable. It's easier to learn things. It's almost as if you're a child again. It's so much easier to learn. And that in combination with therapy seems to, in my mind, really drive the durability of the results that we see in the clinical trials. The patients are able to really dive into therapy in a way that they haven't been able to do before. They're able to make new behavioral changes. Often people will take up meditation or yoga, exercise regimens, things that they hadn't done before to kind of lock in those benefits that they've gotten. And you typically don't get that if you're using in a non-medical setting. Many people use without supervision, which can be very dangerous. If they are under supervision, it's often a friend or someone who's not trained in mental health care. And sure, they might feel better for a while. People in the community, report sometimes that the effects last for weeks or so. But it's rare to talk to people who have used psychedelics in the community who are reporting long-term benefits in the way that we have seen in clinical trials.
Your thoughts about this? None of these are FDA approved. They're still in clinical trials.
Yep.
Yet all over the internet, all over social media, you can see advertisements for, even locally in Ohio for ayahuasca treatment therapies. You can go to, Puerto Rico or any other Caribbean country, or Aaron Rodgers went to Peru for the ayahuasca treatment, and they tout great benefits for this. What's your advice to people who are so, frankly desperate?
If you're struggling with a severe mental health condition, make sure that you've actually tried all the treatments that potentially could help you. We see lots of patients who've tried many medications for depression or anxiety or PTSD, and they're not getting the results that they want, and they think that they've tried everything, and when that's couldn't be further from the truth. Generally when oral medications aren't working, we use interventional psychiatric treatments, like I mentioned before, TMS, ECT. For depression, there's also vagus nerve stimulation. For post-traumatic stress disorder, there's also use of something called stellate ganglion blocks. And so, you want to make sure that you've tried what's actually approved as medical treatments in the U.S. But yeah, we do know that patients are going to seek these experiences out on their own, even when we're telling them it's potentially unsafe. And so my advice would be to make sure that you are not doing something like this on your own. There are risks. There have been reports of people being robbed or sexually assaulted when going to retreats like this, particularly outside of the country where you're out of your element. Maybe you don't know the local area. And so, there's an element of danger there because you are really altered during this period, and it can last for hours. We also know that psychedelics increase something called suggestibility, where you will basically easily follow other people's suggestions without questioning them.
Dr. Barnett, thank you so much for your insight.
Thank you. I appreciate your time.
That'll do it for this week's Prescription for Life. Thank you so much for watching. Until next time, we wish you good health.
Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins' channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.